Another big campaign will begin in the country from today. The National Digital Health Mission (NDHM) will bring a new revolution in India's health sector, Prime Minister Narendra Modi said from the rampart of the Red Fort in Delhi on the occasion of India's 74th Independence Day. Over a year after a blueprint of the 144 crore rupees scheme was launched by the centre, the NDHM may even be linked to the Aadhaar card, Minister of State (MoS) for the Ministry of Health Ashwani Kumar Chaubey told India Today on Saturday. The health ID could likely be linked with the Aadhaar card according to PM's vision in future, Minister Chaubey added. He went on to say, "We want to make healthcare accessible to all even at the village level. Every individual will have a health ID that will have the details of the disease, treatment for the ailment, treating doctor's details, hospital details, etc. Even if someone goes from Delhi to another city or state like Bengaluru, his data will be stored in that ID for easy access." Until now, the enrollment in NDHM is voluntary. While the health ID has not been made mandatory yet, it was proposed earlier that linking it with Aadhaar will be optional if the person wishes to avail any government-linked subsidy scheme or direct cash transfer benefits. The NDHM comes under the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana (PMJAY), the blueprint of which was being prepared by the National Health Agency (NHA) for more than 6 months prior to the novel coronavirus outbreak. What is a digital health ID? Think of it as a digi-locker for all medical and healthcare-related details of an individual, right from birth. A 14-digit serial number will be generated for each individual. The card will store immunization details, surgeries, laboratory tests, hospitals visited, pharmacies, medical purchases etc. The card will be accessible through an app or a website. It will be password protected and would need the permission of the individual for a one-time limited period access by doctors. Access to data: the data will automatically be stored in a government cloud-based access system. However, officials have said that the access to medical records will be restricted to the individuals and even the government will not have access to this data. Ownership of the data shall lie only with the person, the centre seems to suggest. Pilot of the project: in its first phase, the mission will begin in union territories such as Andaman Nicobar Islands, Chandigarh, Dadra Nagar Haveli and Daman Diu, Lakshadweep, Ladakh and Puducherry.